Welcome to a deeper understanding of familial interstitial pneumonia, or FIP. This rare and complex lung disease has a significant impact on those affected and their families. Join us as we explore the intricacies of FIP, from its origins to potential treatments and future research. The root cause of FIP lies in our genes. It's a heritable condition, meaning it's passed down through families. While specific gene mutations vary, they all share a common thread. They disrupt the delicate processes involved in maintaining healthy lung tissue. These mutations can affect the production of proteins critical for lung structure, repair, and function. Identifying the precise gene responsible in a particular family is key to understanding and potentially targeting the disease. Let's delve into what happens inside the lungs of someone with FIP. The genetic defect leads to chronic inflammation and scarring of the lung tissue, a process known as fibrosis. This fibrosis thickens the walls of the air sacs, or alveoli, making it difficult for oxygen to pass into the bloodstream. Over time, the lungs become stiff and lose their elasticity, severely impairing their ability to function. The end result is a progressive decline in respiratory capacity, leading to shortness of breath and other debilitating symptoms. FIP is a rare disease. Because it's familial, it clusters in specific families rather than appearing randomly across the general population. Pinpointing the exact prevalence is challenging, as many cases may go undiagnosed or misdiagnosed as other forms of interstitial lung disease. Research is ongoing to better understand the true scope of FIP and identify at-risk families. The signs and symptoms of FIP often develop gradually, making early detection difficult. The most common symptom is shortness of breath, especially with exertion. Other symptoms include a persistent dry cough, fatigue, and weight loss. As the disease progresses, individuals may experience chest pain, clubbing of the fingers, and ultimately, severe respiratory failure. If you have a family history of lung disease, it's crucial to be aware of these potential warning signs. Diagnosing FIP requires a comprehensive approach. A thorough medical history, including a detailed family history, is essential. Doctors will use a combination of imaging techniques, such as high-resolution CT scans, to visualize the lungs and assess the extent of fibrosis. Pulmonary function tests are used to measure lung capacity and airflow. In some cases, a lung biopsy may be necessary to confirm the diagnosis and rule out other conditions. While FIP falls under the umbrella of interstitial lung diseases, it's important to remember that it is specifically familial. There isn't a formal classification system within FIP itself, but the genetic mutations responsible can differ, leading to variations in disease progression and severity. Identifying the specific gene mutation is crucial for understanding the unique characteristics of the disease in a given family. Currently, there is no cure for FIP. Treatment focuses on managing symptoms and slowing disease progression. Pulmonary rehabilitation, including exercise and breathing techniques, can help improve lung function and quality of life. Oxygen therapy is often required to supplement low blood oxygen levels. In some cases, medications such as antifibrotic drugs may be used to slow the scarring process. For advanced cases, lung transplantation may be considered. Since FIP is a genetic disorder, primary prevention isn't possible. However, genetic counseling and testing can be invaluable for families with a history of the disease. This information can help individuals make informed decisions about family planning and proactive monitoring of their lung health. Early detection and management are key to slowing disease progression. The prognosis for individuals with FIP varies depending on the specific genetic mutation, the age of onset, and the overall health of the individual. The disease is typically progressive, meaning it worsens over time. Recent research is focused on identifying new genetic targets and developing more effective therapies. Advances in antifibrotic drugs and lung transplantation offer hope for improving the quality of life and extending the lifespan of those affected by FIP. Understanding the genetic basis of FIP and exploring novel therapeutic approaches remains a critical area of ongoing research.